South Africans over the age of 50 can now get a second COVID booster shot of the Pfizer vaccine next week. The Health Ministry is encouraging those eligible to do so, especially if they are living with comorbidities like TB, cancer, diabetes and HIV. Dr. Lesley Bamford, Head of Child Health and Vaccination Team Leader for the Department of Health, joins me now to explain further. Thank you very much, Lesley, for your time and welcome to the program. Please just for our listeners, our viewers, explain the qualifying criteria.
So good evening and good evening to the viewers. So I think it's useful to just recap about where we currently are. So any adult in South Africa, that's someone 18 years and older, is currently eligible to receive 3 doses of the vaccine. That can either be 2 Pfizer doses followed by a booster, or 1 J&J followed by 2 boosters. So the change is that people 50 years and older, who are people we know who are most vulnerable to severe disease and death from COVID, will from next week be eligible to receive an additional booster, which is in effect a 4th dose. The criteria are, as mentioned, it's for people 50 years and older. The interval is 4 months, so there needs to be a 4-month period from the last time the person received a COVID vaccine, so 120 days or 4 months. And thirdly, this will be a Pfizer or Comirnaty vaccine. Irrespective of what vaccines one has received to date, this particular dose will be a dose of the Pfizer vaccine.
Okay, so again, and pardon me, if it seems as if I'm asking silly questions, but what happens if all you got were the initial 2 shots, either the Pfizer or a single shot of the J&J, depending on the brand you chose? This is something that comes after having taken those, as you say. You would have gotten, 3 doses, you'd have had your 2 Pfizer and then a booster, or you'd have had your 1 J&J and then you would have had 2 boosters. If you are still sort of lower down on that vaccination rung, this doesn't apply to you necessarily.
Exactly. So we know that people are at different places in the vaccination journey. We know that more than half of adults in South Africa are now vaccinated, and more than 70% of people 60 years and older. Some people have not yet vaccinated, some people have had 1 dose, some people have had 2 or 3 doses. So as you correctly point out, this new eligibility really refers to people who've already had 3 doses. They can go on and now receive a 4th dose. But so, of course, we are encouraging everyone to come forward and get vaccinated. If you are unvaccinated, please come and get your 1st dose. If you've had 2 doses, please come and have your 3rd dose. And then, of course, for people 50 years and older who've had 3 doses, we would encourage those people to come forward and make use of this extension of the criteria to receive an additional booster.
I mean, it goes back to, quite a fundamental question, Lesley. How better are health experts like yourselves understanding of vaccine hesitancy? And what can you do to change people's minds?
So I think it is a huge challenge. And obviously, it is people's choice whether to be vaccinated or not. However, it is very concerning when people are making those decisions based on misinformation or myths about the vaccine. So for the past few months, since the beginning of the vaccination program, we have been working as hard as we can to get accurate information. We also understand that people want to hear that information from someone that they know and trust. So going forward, we're also putting more emphasis on ensuring that we mobilize support for vaccination at local level through working with healthcare workers, community health workers, and other community leaders at local level so that as I say, people can be informed about vaccines by people that they know and trust.
All right, so let's continue then with my silly FAQs. But I find, that sometimes people need the basic answers or the basic questions answered to help them formulate a picture of something that sometimes can be quite complex to understand. So the difference between a booster and a vaccine.
So yes, there can be confusing terminology. So they're all vaccines, and they're exactly the same vaccines. Generally, when we give vaccines, any kind of vaccines, we start with what we call a primary schedule. And that's really introducing the vaccine to the body's immune system so that the body can start protecting itself against the disease. Once we've had the primary schedule, in many cases, we then want to boost the immune system, either because we know usually because we know that over time, that protection that has been built up through the primary schedule starts to wane, it starts to lessen, and so there's a need almost to boost or to remind the immune system.
Yeah.
So that we can be confident that if the person is exposed to the condition, the immune system will recognize it and will protect the individual.
I mean, given, as you say, that protection is almost time-bound, it's not a timeless thing. What you're suggesting then, and what health experts are suggesting, and correct me if I'm wrong, is that we're essentially going to be living with the need to have these boosters on a regular basis.
Well, I think there are many. We've learned a lot over the past 2 years, but there are many questions that remain unanswered. And going forward, we don't yet have all the answers as to what the vaccination program would look like. But remember, every year we need to have a flu vaccine if we want to be protected against flu. And so there may have a scenario where people need to have repeated COVID vaccinations at a particular interval.
Dr. Lesley Bamford, thank you very much for your time this evening. Appreciate your insight in helping us understand this new allowance now for South Africans over the age of 50 to go ahead and get their second COVID booster shot.